When I think about bones, I think about movement and all the tissues associated with it. Medial collateral. This must be the lateral collateral. To keep our knee, that's what we're looking at here, in a hinged kind of position. But what about when our knee is going to twist? Well, if we pull away this patellar tendon, we will see that there are tendons and ligaments, in this case, anterior cruciate on the front ACL, posterior on the back. All right, my point here is we're built to move. Hey, the youngest Olympiad from Japan, 2021 Olympics. Skateboarding is now an official event in the Olympics. That's cool. All right, so vocabulary. Osteo means bone. Osteoclasts are going to reabsorb. Osteoblasts are going to deposit it. And osteocytes are your typical bone cells that occur in these concentric rings I'll be talking about. All right, so be thinking about this. Remodeled constantly. Pressure, hormones, diet. Every day our skeleton's changing. Osteoblasts. All right, that's one of the key words. So when we have an injury or we're growing, osteoblasts are going to take calcium salts and they're going to build a matrix and deposit bone. Let's not worry about the class yet. These are the ones that are going to take it off. There's a lacuna where these osteoblasts live. It's a little cave. And there's canals, canaliculi, that connect these guys, stay alive, to the central canal. Okay, so nutrients are coming in from arteries, and they're going to flow through these canals to keep our bone alive. Over time, these lamellae rings, it's like a tree, rings of growth. But once these osteoblasts surround themselves in bone, then the canals get so tiny that these osteocytes are barely alive. Right. And that's where most of our bones are. Okay, this chart looks complicated, but it's really simple. Yeah. Hypercalcemia is when we have lots of calcium in the blood, which is kind of a good thing because our thyroid gland says, hey, this is good. Let's dump some of that calcium in the intestines. Let's excrete it. Let's put it in the bones like a bank account. All right, and that's how we are till about age 35. We are depositing bone in a very healthy pathway. But if we have hypocalcemia, then the parathyroid gland, which is, okay, this is in the throat region, then the parathyroid says, hey, we need calcium because muscles need calcium for contraction. We need calcium to survive. So where's calcium? It's searching around. It says, hey, it's in the bones. So now we're going to have this PTH hormone tell our body to release calcium so that we have it in the bloodstream. This is not a good situation, and I'll tell you why later. This is why you need to have a cheese stick or some yogurt or spread out your calcium during the day. Yeah, I'll get to that story. Epiphyseal plates, okay, here's a nice extra. So what happens is as we grow, we have a lot of cartilage. And that's why, you know, sometimes there's a car accident and the adults have broken bones and the children don't. And that's because there's a lot of cartilage in the skeleton at an early age, and then, you know, puberty, this starts changing rapidly. It's called ossification. There's the word ossification. And it's the process where hydroxyapatite is deposited. And there's a big story right there. So calcium, phosphate, and other ions. Now, the reason I say it's a big story is that we have learned that hydroxyapatite can be applied to prosthetics. So I'm talking about dental implants, hip prosthetics. Anytime we're going to implant a foreign object into bone, we want that bone, we want to encourage the bone to grow around it. Now, in the old days, they used cement. Okay, surgeons would use cement to attach prosthetics. And what would happen is the bone, native bone, would never really grow into the implant, and so you'd have this osteolysis. And see that dark area? That tells you that the bone mineral density is very light. And so this is going to have to be redone. And look, there's not much bone left. This is an elderly person from my experience. And this, that's a hard decision to make. Arthritis. Okay, we have cartilage between all our joints, and I'll talk about this some more. It's made of chondrocytes, collagen, and a matrix of different fibers. But what you won't see in here is any blood vessels. And so the way cartilage feeds is when we move. It's like a sponge. We move, we take a step, we squish it, and when it expands, it soaks up liquids in the joint, capsular joint. That's a happy situation. But inactivity, it may contribute to arthritis. Now, really, chronic inflammation, well, that's the main reason, because we have these white blood cells that are trying to do their job, but they're consuming our own cartilage. And so inflamed joints are not a good situation. If you have a knee that swells frequently, you need to do something about it, because over time that cartilage is going to get thinner and thinner, and you will have this disease called arthritis. Now, inactivity, I kind of jumped ahead on this earlier. If we can move, as I said, then we can decrease the potential for the cartilage to thin. And that's my research. You know, it was interesting. I present to the Aging Society of America. I work a lot with geriatric people, and I was presenting this in San Diego, and a great Tai Chi master was there, Dr. Lam, and he said, "Why don't you move like a monkey?" Because I have arthritis, unfortunately. That's what got me going on this research. Okay, so my work found that wild monkeys have wide range of motion. Wrong. And so in the zoos, they don't, and they develop arthritis in the zoos. So I talked my daughter into doing 9 days of a very cheap yoga retreat. Anyway, I'm going to move on. Osteoporosis. Osteoporosis is the loss of bone mass. Now, I mentioned age 35. That's when we kind of build this bank account. We're depositing bone until about age 35, and then we start to borrow from it. And that's why if you're really thin, then you need to be thinking calcium in your diet, right? And not mega doses, but here and there you need to spread out your calcium, because your bank account's kind of small, and mine is too. Okay, that's one advantage of obesity. One of the rare advantages of obesity is they have huge skeletons. So they have a massive bank account, but then they have other problems. Okay, I mentioned PTH earlier. Age, estrogen, especially menopause. All right, and this is where women, you know, they have a decision to make at menopause, because there is that cancer connection, but that can be tested for. Well, I'm not going to make any recommendations here. BMD is bone mineral density, and we get a DEXA scan, or it's a type of radiograph or X-ray, same thing, where we can get a T-score, and we can determine, okay, is this person doing okay? Are they developing osteoporosis, which is called osteopenia, or are they full osteoporosis? And what's happening is the dark areas in the X-ray are telling you there's too much space, and it starts affecting their health. It's not just about skeletal health, but it starts affecting other organs, and then hip fractures and immobility. So it's a serious condition, and it's one to address early. Okay, types of joints. Fibrous is a fibrocartilage, and there's almost no space. I mean, think of the skull. Those are joints, the sutures. Now, in an infant, you know, the fontanelles, these cartilaginous spaces are pretty pronounced. But as we get older, they're going to suture over. And by my age, they're almost smooth. You hardly see anymore. All right, sockets of the teeth. Okay, not much motion there. A second type of joint is cartilaginous, and here we have it in the vertebra. Cervical, the neck. How do you know it's cervical? Look at these transverse foramens. Okay, those are holes for nerves. Then you know, okay, it's cervical. Thoracic, long spinous process. Look at these guys. And that's for muscle attachment. Kind of makes sense. Lumbar is the lower, holding a lot of body weight, so the body of the vertebra is very thick. Right? So eat breakfast at 7 cervicals. I have lunch at 12. There's 12 thoracic. Dinner at 5. I don't eat that early, but 5 lumbar. All right. Oh, ribs attachment here to the sternum are also cartilaginous. Synovial, these are the exciting joints. Shoulders, elbows, wrists, hips, knees, ankles. And what we have here is we have a dense connective tissue capsule. See this capsule? And we have an inner synovial membrane. And this is super cool because this membrane is producing a synovial fluid. It's like motor oil, okay? I mean, it's thick and extremely lubricating, viscous. And so the cavity is filled with this lubricant produced by the synovial membrane. I mean, how perfect can that be? You know, like we are built to move. And okay, hyaline cartilage, the caps of the two bones that are articulating. Okay, articulate means to join and form a joint. And you can see the space. Man, this is a healthy joint. Oh, the radiograph is not showing the here, but that's a thick pad. So I'm thinking this is a young individual without any signs of arthritis yet. Okay, let's do amazing joints that have a lot of attention given to them because of injuries. Shoulder, the clavicles, the collarbone. Scapula, shoulder blade. Humerus is the arm. Now, they form an important joint, and I want you to pay attention to the coracoid and acromion because on the scapula here, shoulder blade, are two important processes. Acromion, coracoid. And you can feel these with your fingers. And these form an important anchor point for all kinds of muscles. And they also create a little impingement, which I'd like to show here in a bit. The supraspinatus is going to slide under these processes. And when this happens, we're going to have impingement. And here's the word, impingement injury. So when someone has a shoulder injury, there you see it, that's the supraspinatus. Okay, there's other muscles there, but the supraspinatus is in a vulnerable position because it has to slide under these bony processes. Now, sometimes when someone falls, there it is again. Now you can see it really well here. You see how it's going to slide under? That's the acromion, A before C. Scapula, spine of the scapula. Acromion, are you going to give us a label for that? Yes, okay. And now you can see the vulnerability of the supraspinatus. Okay, think of spine of scapula, supra, under the spine. Yeah, okay. Let's move on because I want to talk about the knee. The AC joint is just the joining of the acromion and the clavicle. Someone falls and they're running really fast. I can kind of assume there's going to be damage there. Okay, I can just see when someone falls, I can almost guess what's going on in their joint. Okay, meniscus. Well, let's look at the bones first. Okay, we have the femur, tibia, the skinny little fibula, patella or kneecap. And so tying those all together, there's a pillow of meniscus cartilage. We have these cruciate ligaments that we saw at the beginning of the video. And then we have the lateral. And how do you know it's lateral? Fibula side, okay? Fibula is on the lateral, tibia is on the medial. All right, there's little clues to help us to understand the human body. Wow, this is so cool. Thank you for listening.